Do you know there's a particular food that is being produced in Nigeria or in Africa, let's just say, that increase your chances of giving birth to a twin? And also, do you know some people have higher chances of giving birth to a twin? Do you also know there are some medications that can be prescribed by your doctor that increase your chances of giving birth to a twin? Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be talking about giving birth to twins, what you should know. Who are those people that have higher chances of giving birth to a twins? What medications are likely going to increase your chances of giving birth to a twin? And also that particular food that is produced in Nigeria, that is produced in Africa, that increase your chances of giving birth to a twin. But before we go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button. Turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, all our discussion today is going to be about giving birth to twin babies. Giving birth to twin babies. But before we go further, if you have not watched our video on how twins is being formed and the various types of twin, I'm going to leave the link in the description box below so you have access to it. We all know that when we talk about twin, it simply means two babies. It could be identical or fraternal twins. First of all, let's talk about those who have higher chances of giving birth to a twin. The first set of people that have higher chances of giving birth to a twins are those who have a family history of twin in it. Those who have a family history of twin in it. For example, a couple got married, the man and the woman. The woman has a history of twin. That can increase the couple's chances of giving birth to a twin. But if it's the man, it doesn't really increase the chances of giving birth to a twin. But if it's the woman that have a history, the brother is a twin or the mother gave birth to a twin, there's a twin history in the woman's lineage, that is likely going to increase the chances of that woman giving birth to a twin. Then the second set of people that have higher chance of giving birth to a twin are women who are greater than 35 years of age, who are 35, 36, 37, 38, 39, 40, who are higher, who have high age, who are advanced. Let's put it that way. They have increased chances of giving birth to a twin. Why? Because when they're getting close to 40, they are more than 35, they tend to release multiple eggs. They tend to release more than one eggs. And we all know that when the sperm come, it fertilizes those two eggs. That can give them what? Fraternal twins. Because when a woman advances, her chances of giving birth to a twin is on a high side. Then the third set of people that are likely going to give birth to a twins are people who are very tall. Yes, 5 feet plus and above. They are very, very tall. Those set of people have higher chances of giving birth to a twin. And the fourth set of people who have higher chances of giving birth to a twins are Africans, Nigerians, Africans. They have higher chances of also giving birth to a twin. I know what you want to hear about are the medications that help you increase your chances of giving birth to a twins. Let me put a disclaimer on this particular video. These medications are not what you just go over the counters and get and start taking daily. No, these medications are being prescribed by the doctors and supervisions are being taking place to ensure everything go well. So it's not something you just go and get this medication. They should be gotten under the doctor's prescription and they should be gotten with the doctor's guidance. So I am just sharing this video with you to educate you, not for you to go to the nearest pharmacy to get this medication. So the first one I have to share with you is clomiphene citrate. Clomiphene citrate. I believe a lot of people must have heard about clomiphene citrate. What clomiphene citrate does is that it stimulates your ovaries to release more eggs. it stimulates your ovaries to release multiple eggs. And you know, when multiple eggs are released, sperm comes, they fertilize this egg, and 2 babies are being formed. Research has shown that 100 babies in 1,000 babies, 100 babies are twin in 1,000 babies that are being conceived with clomiphene citrate. That is, clomiphene citrate increase your chances of giving birth to a twin by 10%. Is that not good? Yes. So clomiphene citrate helps to stimulate the ovaries to release multiple eggs. And when there are multiple eggs, there are going to be increased chances of the sperm fertilizing these 2 eggs and giving birth to what? Fraternal twins. Though in 2006, there was a research being done, and it says that identical twins were also formed from what? From clomiphene citrate. Then the second medication that is being taken to increase your chances of giving birth to a twins is letrozole. Letrozole has similar mechanism of action, let's put it that way, with that of clomiphene citrate. That it functions the same way, in the sense that it stimulates the ovaries to release more eggs so that fertilization can take place, so that the sperm can see the 2 eggs to fertilize. So that is the second medication. Then the third one is the gonadotropins. The gonadotropin also increases fertility. They stimulate the ovaries to produce more eggs. But when it comes to gonadotropin, a lot of eggs are being produced. It's not just 2. You can get up to 5 eggs being released with gonadotropins. So your chances of giving birth to a twin with gonadotropin is around 20 to 30% per se. Around 20 to 30%. You'll be able to get what? Twin with gonadotropins. Because it's not just 1 egg that's being released or multiple eggs. 2, more than 2 eggs are being released. You can get up to 4, you can get triplets, you can get quadruplets by using what? The gonadotropins. Then there's no way I will end this video without talking about in vitro fertilization. Yes, in vitro fertilization. Yes, with in vitro fertilization, you have a higher chance of also giving birth to a twin. For those that have not watched our video on in vitro fertilization, I'm going to be dropping the link in the description box below, so you have access to the video to know what in vitro fertilization is all about. But let me give you a tip of the iceberg. In vitro fertilization is when the sperm and the egg are being brought out of the individual's body and they are fertilized in the lab, then taken back into a human body for the baby to grow. So with in vitro fertilization, you also have a higher chance of giving birth to a twin. Yes, you have a higher chance of giving birth to an identical twins or fraternal twins, depending on when the embryo is being transplanted, into the body. So it all depends on the time it's been done. So IVF also increases what? Your chances of giving birth to a twin. So you can see these 4 methods that are likely going to increase your chances of giving birth to a twins. I just want to let you know that this method is not 100% successful. I'm not saying when you do this method, there's 100% that you are going to get twins. But I only said that it increases your chances of giving birth to a twin. And don't forget, don't go get these medications over the counters, but rather visit your doctor for good prescriptions in order for that to be possible. You will want to ask, how do I know I am carrying a twin baby? How do I know that I am carrying a twin baby? Most women with twin baby, they usually have frequent vomiting and nausea and vomiting. They vomit a lot. I saw that during my maternal and child health posting in the community setting, and most women with twin pregnancy, they usually have that vomiting. They vomit a lot. Then the second one is that when a woman is having her tummy is bigger than her gestational age. Her tummy is bigger than her gestational age. We all know, as a midwife, when you go to when our patient comes, generally, when we measure and the belly is at the tummy, you understand, at the belly button. Yeah, it's at the baby is at the belly button, around that area. We say that baby is 20 weeks. But if it is not 20 weeks yet, the baby is not 20 weeks yet, and is already getting to the belly button, maybe a 12 weeks old pregnancy is already getting to the belly button, then we can say, okay, let's suspect it's twin pregnancy. But the most definite way to know that you are carrying a twin pregnancy is through an ultrasound scan. Yes, it's through an ultrasound scan. So when you do that, it tells you that you are carrying a twin pregnancy or just a single pregnancy. So these are what I want to share with you today in regards to giving birth to twins. I hope this video is beneficial. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all our returning subscribers, this is Nurse Mary saying thank you. Bye, and see you in our next video.